as far as what we were already doing in the practice and then what we had to change, what we were already doing, I mean, we have very good access. We have 6 sites. Of our 6 sites, 3 of them are open 9 a.m. to 9 p.m. Monday through Friday, and 3 of our sites are open on weekends. And one of our sites is open every holiday morning of the year, Christmas, New Year's, Thanksgiving, whatever. So that, and then one of us obviously is on call 24/7. So we have really, really good access. That wasn't something we had to change, although we had to document that in the application process. So that was something we always did very well. Taking care of kids with asthma and ADHD and other kinds of pediatric chronic conditions, one of the things we always felt we did a really good job, but what we really needed to do was document and finalize evidence-based protocols, so that even though all of us thought, oh yeah, we're following all the latest recommendations, we wrote it all down and we made sure that everybody was following the protocol. So for instance, asthma, in our EHR, you have a problem list. Well, when we first started looking at it, we're looking at kids that are coming in, they're wheezing or whatever, we're saying, but there's no diagnosis on the problem list. There might have been for that visit. So one of the first things we did with all of our providers is we said, we have to go through when a patient comes in and you've been prescribing asthma meds for them, make sure on the problem list it lists asthma, because documentation is really important. Also, it's better medicine. So that was very simple, but we had to do that. Then what we required of everyone is that every child with asthma have an asthma action plan. And we had to, and that couldn't just be written out, handwritten, but it had to be documented and it had to be in the EHR. So we put that process in. Then we adopted something called an asthma control test, which is a questionnaire way of monitoring how the child is doing with their asthma when they come in to a visit. We had to make sure that was documented. And then we put in a spirometry program, which we had not had before, and we had to teach everyone how to do that, and again had to document that and get that all working. And now what we've done is we've implemented a callback system in our EHR, so that when we see a child with a certain level of asthma, for instance, our mild persistent asthmatics, we bring them in every 6 months. Our moderate persistent asthmatics, we bring them every 3 to 4 months. Our intermittent asthmatics, we only see them annually for their checkups. But that all had to be monitored, had to be prescribed, and had to be documented. So that's just one example of how we took a chronic illness, broke it down, made sure that the data was being entered so that reports could be done. And then what we would show the HMOs is this was our baseline when we started. Here we are 3 months out. This is how much of these things we're doing, where we're going to be in another 3 months.